Welcome to this presentation. My name is Liz Burns. I'm from the University of Salford and I'm part of the Communities in Charge of Alcohol evaluation team. Communities in Charge of Alcohol, otherwise known as CICA, is a multi-level, multi-component alcohol harm reduction intervention. It involved volunteers from 9 different geographical areas of Greater Manchester taking part in a 2-day training programme accredited by the Royal Society of Public Health to become alcohol health champions, the first alcohol-focused health champion role of its kind. Alcohol health champions are trained to be able to offer brief advice to family members, friends and neighbours in the communities in which they live or work, as well as take action to influence the licensing process using the 2003 Licensing Act. And that is how CICA aims to reduce alcohol-related harm at 2 levels, both the individual level as well as the community level by influencing alcohol availability. So at the start of the project in each of the 9 areas, we measured the external context. And we defined the external context by using these 12 different variables. We observed these variables in preparation meetings that took place in each of the 9 areas. And we scored, depending on whether or not the variable was present, partially present or absent, we scored 1 if present, half a point if partially present, and 0 if absent. So the maximum score that an area could achieve was a maximum score of 12. We then sense checked with the local stakeholders involved in the CICA programme to check that our observation of scorings matched their experiences. Following this, we used a Spearman's rank correlation test to explore whether or not there was any correlation between what we called the infrastructure score with the total numbers of champions trained in the area. And the total numbers of champions trained was our implementation outcome of interest. And what you can see here is that we found that there was indeed a positive correlation between having a higher infrastructure score and having higher numbers of alcohol health champions trained in an area. As a second stage, we then used a Mann-Whitney U-test to explore whether or not there was a significant correlation between any of those specific external contextual factors with the implementation outcome in terms of numbers trained. And we found that there were 4 specific external contextual factors that were significantly related to having higher numbers of alcohol health champions trained. So our findings demonstrate this added value of not just defining the external context, but also testing the correlation between individual external contextual factors with intervention outcomes using mixed methods. And also, if establishing such a volunteer champion-based approach to reducing alcohol-related harm, our findings suggest that there are 4 specific factors that will significantly have an impact on the likelihood of evidence-based practice being put into place. And this includes then having a service provider in place to deliver the intervention, having a commission contract in place, having an existing pool of volunteers to draw from, and also having formal volunteer processes in place all at the start of the project. So thank you very much for your time and for watching. If you have any questions or comments, don't hesitate to get in touch with me, Liz Burns, or visit our CICA Research Hub. The evaluation is funded by the National Institute for Health Research. Thank you.